Howdy, I'm Dr. Ernie Bowling, Chief Optometric Editor of Ophthalmology Times. I want to talk for just a minute about a rebuttal I wrote to a couple blog spots on our sister publication, Ophthalmology Times. A first-year ophthalmology resident, University of California, Irvine, Dr. Zach Oakley, recently wrote two web posts regarding the optometric scope of expansion bill in California, Senate Bill 622. His initial post offered some tepid support, but his second post about a week later, after what I can only assume was a prolonged trip to the ophthalmological woodshed, came out very strongly against the bill. I initially wanted to just ignore his ramblings. As I said, he's a first-year ophthalmology resident, and he readily admits he doesn't understand everything. However, since it was on our sister publication, I felt we needed to respond. In addition to the fact, I just don't think he understands what an optometrist does. He makes a statement that how can we compare ourselves to spectacle peddlers? And he doesn't understand that optometry's moved way beyond that. We've been treating ocular disease with medication since 1976. A great number of states allow topical and oral medications, minor surgical procedures, as well as lasers in some states. So we've moved far beyond being just spectacle peddlers. He also makes a comment in there about ocular morbidity of the patients if this bill was allowed to pass. Again, that is a very old and worn and fear-mongering argument that has been used. I'll give him a personal history lesson. In the mid-90s, when I was practicing in Georgia, I, along with a good number of ODs, got the opportunity to appear before the legislature and lobby in favor of the Optometric Scope of Expansion Act, where we were trying to gain oral medications and the ability to treat glaucoma. I remember becoming especially incensed during one public hearing for this bill when a medical doctor stood up in front of the legislature and said, and I quote, "People of Georgia will be dropping dead in the streets if this bill is allowed to pass." End quote. Well, the bill passed. Nobody dropped dead in the streets of Georgia then, nor in the 20 years since. Optometry has enjoyed a sterling record regarding patient care when we've gone before our respective state legislatures and asked for expansion of our scope of practice, because we take our privileges to treat our patients very, very seriously and are not going to squander those away. I would say to Dr. Oakley that when you graduate, when you complete your residency, you will have optometrists out there who will be willing to work with you in a spirit of mutual respect and cooperation. But it's only with that mutual respect that each one of us recognize the unique talents and abilities that we each one bring to patient care, that mutual cooperation will succeed. I'm Dr. Ernie Bowling. Thank you.